Holistic traditions in healing practices. Holistic traditions encompass centuries-old wisdom rooted in balancing physical, emotional, spiritual, and environmental well-being. These practices challenge reductionist views of health by emphasizing interconnectedness rather than isolated symptoms. In an era dominated by technology-driven medicine, holistic approaches offer a return to ancestral knowledge validated by growing scientific research. From acupuncture to herbalism, these traditions bridge gaps between tradition and innovation. The origins and evolution of holistic healing. Holistic healing dates back to prehistoric times, with early humans relying on plant-based remedies and ritualistic ceremonies to treat ailments. Archaeological evidence suggests Neolithic societies used herbs like willow bark, a precursor to aspirin, for pain relief. Cultural exchanges along trade routes spread healing practices across continents. Indian Ayurveda influenced Persian medicine, which later shaped European botanical studies during the Renaissance. This cross-pollination created a rich tapestry of global healing systems. Ayurveda, originating over 3,000 years ago, this system categorizes individuals based on three dashas, Vata, Pitta, Kapha, and prescribes tailored diets, lifestyles, and detoxification rituals. Tai Chi and Qigong, developed in China, these movement-based practices combine martial arts with energy cultivation techniques to enhance vitality and longevity. Core principles of holistic health. Holistic traditions share fundamental tenets that distinguish them from conventional Western medicine. Central to these philosophies is the belief that true wellness requires harmony between body, mind, and environment. Mental-emotional states significantly influence physical health according to holistic frameworks. Chronic stress, for example, disrupts hormonal balances linked to conditions ranging from autoimmune disorders to cardiovascular disease. Natural substances often serve as primary therapeutic agents. Plants containing bioactive compounds like curcumin, from turmeric, or resveratrol, found in grapes, demonstrate anti-inflammatory properties supported by clinical trials. Evidence-based validation of ancient remedies. Modern pharmacology has identified active ingredients in many traditional medicines. The World Health Organization estimates that 80% of people worldwide rely on herbal treatments, many of which have been scientifically tested. For instance, artemisinin derived from sweet wormwood was pivotal in developing effective malaria treatments. Such discoveries highlight the value of preserving indigenous knowledge while applying rigorous scientific scrutiny. Traditional healing systems around the globe. Diverse civilizations developed sophisticated healing methodologies adapted to local ecosystems and cosmologies. African traditional medicine employs spiritual consultations alongside plant-based treatments, reflecting communal values central to its philosophy. Polynesian healers known as kahuna utilize chants, massage, and sacred oils to restore equilibrium. Their practices emphasize ancestral connections and the importance of living in alignment with nature's rhythms. In South America, shamans incorporate ayahuasca ceremonies to facilitate psychological healing. While controversial due to legal restrictions, these rituals continue attracting seekers seeking profound self-discovery experiences. Integrative approaches in modern healthcare. Leading hospitals increasingly adopt integrative care models combining conventional treatments with complementary therapies. Cancer centers now offer acupuncture for chemotherapy-induced nausea and guided imagery for pain management. This shift reflects growing recognition of psychoneuroimmunology, the study linking psychological factors with immune function. Mindfulness-based interventions reduce inflammation markers associated with chronic illnesses. Patient-reported outcomes show improved quality of life metrics when holistic strategies accompany standard protocols. Survivors undergoing breast cancer treatment report fewer side effects when practicing yoga and nutritional counseling. Challenges facing contemporary practitioners. Despite increasing acceptance, holistic professionals face systemic barriers, including limited insurance reimbursement and regulatory inconsistencies across jurisdictions. Many states require licensing for acupuncturists but classify herbalists as unlicensed providers. Skepticism persists regarding efficacy claims made by some alternative therapists. Responsible practitioners emphasize transparency by disclosing potential interactions between herbal remedies and pharmaceutical medications. Cultural sensitivity remains crucial in practice settings. Misunderstandings about spiritual components of certain traditions may lead to dismissive attitudes from healthcare institutions lacking adequate training in diverse healing paradigms. Fostering interdisciplinary collaboration, bridging divides between conventional and complementary fields, requires structured dialogue platforms. Academic conferences featuring both MDs and naturopaths promote mutual learning opportunities through case presentations and joint research projects. Medical schools incorporating courses on integrative medicine better prepare future physicians to engage respectfully with patients' preferences. Students learn about clinical trials evaluating homeopathy, aromatherapy, and other modalities. Telehealth innovations expand access to holistic services globally. Virtual consultations enable remote clients to receive guidance on dietary adjustments or breathing exercises tailored to their individual needs. Risks and ethical considerations. While generally safe when practiced responsibly, some holistic therapies carry inherent risks. Unsupervised use of potent herbs like St. John's wort can interfere with antidepressant medications, causing serotonin syndrome. Ethical guidelines stress the importance of informed consent. Clients must understand limitations of alternative treatments compared to proven medical interventions for serious conditions requiring immediate attention. Environmental sustainability concerns arise with increased demand for medicinal plants. Sustainable harvesting practices become essential to prevent ecological degradation and ensure continued availability for future generations. Building personalized wellness plans. Effective holistic care begins with comprehensive assessments addressing lifestyle patterns, emotional history, and environmental exposures. Functional medicine practitioners use lab tests to identify underlying imbalances contributing to symptoms. Nutritional profiling helps tailor diet recommendations based on genetic predispositions. For example, those with MTHFR gene variants benefit from methylated folate supplementation rather than synthetic folic acid. Mind-body practices such as progressive muscle relaxation or visualization techniques alleviate anxiety by activating parasympathetic nervous system responses. Regular engagement enhances resilience against stressors. Community building through shared knowledge. Local wellness circles foster peer support networks where participants exchange practical tips on implementing daily routines aligned with holistic principles. Group activities like walking meditations create social bonds, enhancing overall satisfaction levels. Herbal workshops teach sustainable gathering techniques while promoting awareness about endangered species. Participants gain hands-on experience identifying edible wild plants safely. Cross-cultural festivals celebrate diversity in healing traditions. Events showcasing Japanese moxibustion beside Native American sweat lodges encourage appreciation of universal themes present across various systems. Conclusion: holistic traditions provide time-tested solutions addressing complex modern health challenges. By honoring interconnections between all facets of human existence, these approaches complement conventional care rather than compete with it. To explore holistic options thoughtfully, consult certified practitioners who collaborate openly with your primary healthcare provider. Begin small by integrating simple habits like mindful eating or nature immersion into your routine gradually.